Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome back to this week's episode of the podcast, and thanks for joining me. This week, we have a new topic that we're highlighting on the Healing Pain podcast. We're discussing resilience and growth after trauma, also known as post-traumatic growth, which is a theory that explains the positive human transformation that can occur after any type of physical trauma, psychological or emotional trauma, spiritual trauma, or even after struggling with a prolonged illness. Joining us this week to discuss trauma and post-traumatic growth is Dr. Melissa Zeligman. She's an assistant professor of counseling education at the University of Central Florida. Prior to her doctorate, she served as a mental health counselor, working in agency, medical, legal, as well as high school settings. Today, her research focuses on trauma work, including the experience of post-traumatic growth. Positive growth or post-traumatic growth is something that interests me, especially within the context of treating people with chronic pain or other chronic health conditions that we see in the physical therapy or other physical medicine or rehabilitation settings. I know you're going to learn a lot about this topic, and hopefully you will embrace it as much as I have in both clinical practice and have become very interested in the research. If you're interested in learning more about a trauma-informed approach to treating chronic pain, make sure to check out our course at the Integrative Pain Science Institute.com called Trauma-Informed Pain Care, where you'll learn how to treat trauma from a trauma-informed perspective for people living with chronic pain. Okay, without further ado, let's begin and let's learn all about post-traumatic growth. Hey there, Melissa. Welcome to this week's show. It's great to have you here.
Thank you so much for having me. Great to meet you.
Likewise, I'm excited to talk to you. This is a new topic that I really haven't covered on the show. Even when I think back to the almost 300 episodes that we've recorded, people have mentioned the term post-traumatic growth, but we haven't really had an episode where we started to dissect what it is and how it relates to chronic health, how it relates to chronic pain, and of course, the things that we should be aware of as licensed health professionals. I think a good place to start, because I know you've done research on this, is to just tell us what post-traumatic growth is, if you can define it for us.
Absolutely. Perfect place to start. And I'm glad that we're able to bring this topic if it sounds like it's time for it to be here. So I think most people are familiar when we talk about chronic illness or any form of trauma, because in order to talk about post-traumatic growth in this way, we have to conceptualize chronic illness in some ways as a trauma. And I think when people think about trauma, it's easy for them to think about post-traumatic stress disorder. That's a term that's used pretty commonly, right? And it's easy for us to think of some of those more negative symptoms that come out of living with a chronic illness or experiencing something that's highly stressful or a crisis even. And so post-traumatic growth is looking at the other side of that, really. And so not that those stressful symptoms or negative symptoms aren't present, but that at the same time, there's this possibility for something more to come out of this experience. And so sometimes people ask me, well, how is that different from resilience? And so I like to give the example that we all have a little bit of like a resting kind of our status quo for our functioning, right? And so we all have where we're functioning at today. And if something really stressful or traumatic happens later, and we're able to get back to this place of functioning that we're at today, that would be resilience. We're able to get right back to where we were. But if we're actually able to move up in some areas and grow and develop in some areas, now that's post-traumatic growth. So it's not just that we're able to maintain during crisis, it's that we're actually able to move forward and grow in some areas following crisis, which, could be chronic illness.
So there's a lot of hope in here, a lot of hope in this type of approach or this type of construct, as you mentioned.
Absolutely. Yeah. And hope is actually, hope or optimism is something that can really help people experience this sometimes.
As health professionals, what types of traumas should we be, before we get to the growth part, we probably should just touch on, because people use the term now trauma so often.
Right.
Some people understand things like big T and little t, and people are becoming more aware of trauma sensitive or trauma informed approaches. What type of traumas should health professionals be on the lookout for when they're evaluating their patients?
Yeah, so and maybe this is my personal just bias here, but I like to really conceptualize trauma from more of like a sociocognitive model. And so from that lens, we're saying anything that shifts our worldview or shifts our idea of what is fair. So if you think about, in terms of a chronic illness, or you could think about any sort of trauma, really, somebody who's lived through a natural disaster or had an accident, or some sort of abuse, suddenly their sense of what is just and right in the world has really just been shifted. And so that can certainly happen for somebody who has a new diagnosis with a chronic illness or is living with long-term pain and trying to make sense of that. Suddenly it might shift what we thought, oh, well, good things happen to good people, right? Mm-hmm. And it turns a little bit of that on its head. And so from that model, we can really start to see anytime somebody's experienced that shift in worldview or really had a violation to what their beliefs are about the world, we can start to conceptualize that as a form of trauma.
So worldview is a big part of this, because so basically you're going about life.
Right.
You're a good person, so to speak. You're going to work, right. You're raising your kids, you're paying your taxes, you're doing all the things you should do.
Right.
And then you experience something that causes a major shift in the way you view the world, or the way you view yourself in relation to the world, maybe.
Absolutely. And that's an important piece. Like, how do I fit in here? And what's my idea of what is right and just in the world and where I fit in there? And it can really shift that and violate some of the ways that we viewed the world.
Can you give us an example, maybe like a client or past patient example of how you might have seen that occur in someone?
Absolutely. So I think about, so there's a lot of intersection here too, when we think about race and gender and all of those pieces as well. But I think the piece that I said earlier about this idea that good things happen to good people. And maybe, we hear this all the time. If we know somebody who's gone through a difficult life event, we're so quick to say, try to make sense of it and make meaning and say, well, there was a reason or a purpose for this. So it's just kind of our autopilot to want to make sense of things as people, and it brings us comfort. And so then when something happens, so previously, some of this work grew out of my experience working with individuals who were living with HIV. And so to have a diagnosis like that and suddenly say, well, this doesn't fit in to these ideas that I had about the people who might get diagnosed with HIV. And so I have to now shift what I thought was true for not just myself, but what I thought was true for everybody else. And what's the reason for this? How do I make sense of that quick instinct to say, oh, well, everything makes sense and things happen for a reason. Well, what's the reason? And so trying to make sense of something that sometimes takes a bit of navigating to try to make meaning, it can be really exhausting. And certainly many of my clients have gone through that process, clients living with HIV specifically. And that process is actually what can help get to a place of growth, which is the beautiful part here, is that process is then what eventually can lead to post-traumatic growth.
Right. So that phrase you said, everything happens for a reason. You hear people say that all the time.
Oh, for sure. Yeah.
And this makes us think about that in a much different light.
Right.
So where, I guess, I'm still curious, I obviously you've done research in this area. You teach at university level. Was there something specific that brought you to this one? It's a niche topic that I don't think gets enough attention, actually.
Sure. So like I said, I was working with individuals living with HIV, and much of this work around post-traumatic growth, or PTG, really started to take place with cancer survivors. And so as I was working with individuals who also were living with chronic illness just in a different way, I started to hear stories of people saying, I wouldn't be substance free. I would no longer not be using substances or abusing substances at this point in my life, if not for this HIV diagnosis. And started to say there's some sort of phenomenon going on here. And, I'm always quick to say it can sound very Pollyanna. It's not the Pollyanna approach. It's not that people were grateful for chronic illness in their life, but they could also see that, oh, something came from this. And so I started to experience this phenomenon with clients and was just really curious to see what was going on, and started to see that there was something that Tedeschi and Calhoun had kind of claimed as this post-traumatic growth that was happening, but it was primarily looking at cancer survivors. And so there's the piece that maybe makes HIV different, or certainly makes diabetes different, are some of these illnesses that also bring with it stigma and shame. And so I started my research looking at post-traumatic growth and really trying to understand how stigma or shame might fit into that picture as well.
Mm. Tell us, in the research, I believe post-traumatic growth has like 3 to 5 different aspects of it that you can actually test for it with a certain tool. Maybe you can give us kind of some of the more scientific evidence-based background about what defines post-traumatic growth if you're a clinician trying to measure this.
Sure. So there is an inventory. There's a post-traumatic growth inventory that can measure these things. And where it's measuring it is on 5 domains. And so some of those are relationships with others. And again, if you think about the bulk of this work being with cancer survivors, it can be easy to conceptualize how somebody who maybe has gone through cancer diagnosis or a series of treatments, and certainly face some fears about what life would look like, how they talk about their relationships with others growing. So I'm now closer to my family than I've ever been. I have a relationship with my children that I didn't have before because of what I've gone through. Some of the other things would be new possibilities. And so it is not uncommon for individuals who go through a scare or treatments like cancer to say, wait a minute, I am really starting to second guess my career, and maybe I want to stop doing what I've done and actually do something that'll make me happy for the rest of my life, and think about their future in new ways. Personal strength is another one. Obviously people who go through something like a chronic illness or cancer will start to say, I didn't know I had it in me to be this strong and to be able to get through this. Spiritual change is a huge one. And we could have a whole podcast talking about the way that spirituality plays into this. And so for better or for worse, people often find spiritual changes. And so turning to a higher power in a way that they didn't used to, or sometimes having a bit of stress or anger with their higher power. And the last one is appreciation for life. If you've been diagnosed with cancer or living through a chronic illness and have potentially had to think about your own mortality for the first time, most people come away with a stronger appreciation for what they have and a new zest for life. And so those are the ways that the post-traumatic growth inventory measures growth. And certainly those are the domains that we typically see people grow after that type of stress.
Then it makes me wonder, do we have a way to identify who's more likely than others to maybe enter into post-traumatic growth, and who might we be concerned might not have the skills to cope with, obviously, the trauma that has happened in their life, and how can we help them facilitate that growth? Right.
Great questions, because obviously there's so many great outcomes that come from post-traumatic growth that we really would love to facilitate that in our clients. And so we do start to see some demographic differences. A big one is in gender. Women, just in general, tend to experience PTG at greater rates. And a huge part of that is because one of the greatest predictors of PTG is support. And women tend to be better at identifying support and turning to others and getting those needs met. And so, as clinicians, whether medical doctors or mental health professionals, one great way that we can help to support our clients and get to this growth is to provide that support. So whether it's support groups or having individual counseling, providing that space so that people can kind of get that support for what they're going through. So we do see that women tend to. We also see, I mentioned the spiritual growth, a huge piece of it, and that ties into the support as well. So people who maybe have existing spiritual communities that they're able to turn to can be a huge gift in getting to that place.
How much is one's ability to cognitively reappraise what happened coming? Because you mentioned resilience before. The resilience is different than post-traumatic growth, but the little research I've done on post-traumatic growth, it definitely sounds like there's some type of reappraisal process that someone has to go through, right, where they're not only reappraising their own thoughts, but they're reappraising the world that they're functioning in.
It's huge. It's huge. I'm glad you bring that up. And so sometimes I feel like this part of it gets a little bit of a bad reputation, because at least in my world, in mental health, sometimes when we talk about things like rumination, it can be said as a negative thing. We don't want people to be ruminating on the events that happened, right? However, yeah, there's this reappraisal. And so there's something healthy that can come from a little bit of healthy rumination. And the big piece here is meaning making. So a huge piece here is that meaning making. And so if you're able to think about the event, ruminate on the event, or ruminate on this new diagnosis, again, we as people just naturally want to make meaning. And so, whether we want to or not, oftentimes we're going to find ourselves ruminating about these things just in an attempt to make meaning. And again, I get so nervous talking about this. I want to give the warning that it's not all rainbows and butterflies, because we oftentimes, again, that's our response when somebody has gone through something painful. Well, this was meant to happen, and certainly that's rarely a comforting thing to hear when you've gone through something painful or have just been given a diagnosis that feels really scary. And so it's not that, oh, well, thank goodness this happened in my life. Thank goodness I was given this diagnosis of chronic illness. But also, with that being here, how can I make sense of that in my own life? So like the client that I gave the example of, I would still be using substances if not for this HIV diagnosis, is one example of how, well, now that this is part of my life, how can I try to find some meaning that makes sense of living with this?
That's interesting to think about, because obviously you mentioned rumination tends to be this negative thing.
Right.
How do we, in essence, stop rumination, so to speak?
Right. Or how do we make it really intentional? So how can I have conversations? And this is where support is so important again. Not just having people in my life, but having really meaningful relationships where I'm able to have these conversations and talk about what I'm going through. And it leads to me slowly making sense of this new part of my life.
So a positive aspect of rumination.
Yeah, it can really be used in a healthy way.
Yeah. And you mentioned meaning.
Yes.
Which I'm sure people right away think about Man's Search for Meaning.
Yeah.
Obviously, pivotal book by Viktor Frankl.
Yes, I tell in all my presentations, I'm like, if you haven't read that, that's the only thing I need you to take away from here today.
Yeah. Is there, because the book leads leads all of us to think, what's my search for meaning in life,
right.
Whether I've had a trauma or haven't had a trauma. Is it always healthy for people to search for the meaning, so to speak? Or does that come up through a process of obviously working with therapists or working with support groups? And can that search for meaning, I guess become maladaptive, if we want to use that word?
Sure. I think that the risk there is, again, if we try to ignore the pain or the suffering that also may be tied to the meaning. And so, if we think of somebody who maybe has a diagnosis or somebody who's been through a great loss or another form of trauma, to say that this meaning takes away that pain or excuses that pain, I think can be really potentially harmful. And so we want to kind of ride that line of making sense of what you're going through and not saying, well, this is the reason why you've been through this pain, and now that pain is almost justified, because those two things can coexist. We can try to make meaning of what we're going through and still be in a lot of pain and need a lot of protection and kind of support and comfort during that time.
I like that. So it's not this or that, it's
right.
This and or this with.
Right. And actually for post-traumatic growth, it's a pretty curvilinear relationship. So, it's called post-traumatic growth, right? The T is in there. So we need to have some sort of pain or trauma present to even have the growth. But if we get to an area where the pain or the trauma or the distress symptoms, if we think about post-traumatic stress disorder, is so present and so high, we're at a place where we're not really able to get to a place of growth. So it's finding this balance of how can we eliminate some of that distress so that we're able to even grow. And so the first step when you're working with clients might not even be considering post-traumatic growth, but how do we work on eliminating some of those distress symptoms so that the person can even get to a place where growth is possible?
And right. So over time, I can be actively working with my distress.
Right.
At the same time, I'm in essence searching for meaning in this greater event that's happened.
Absolutely. And we often see, when we do the research, we see both of those things coexisting at the exact same time with clients. So within a number of samples, with chronic illness certainly included. So individuals are still reporting a lot of trauma or distress symptoms at the same time that they're reporting these growth symptoms.
Yeah. And you brought up a good point a couple moments ago, which I think we should talk about a little bit. It's not like when someone first comes to a health professional, they're working on like post-traumatic growth, like the first visit. Like that's not necessarily the aim of what we're talking about here.
Right. Right. Yeah, there's still plenty of opportunities. Right. I mean, I'm sure we've all had a bad day, or we've all gone through something stressful, and somebody say like, oh, well, this was meant to be, this was, if you're spiritual, this was God's plan. And those all have beautiful intentions behind them, but also can be really invalidating to say, well, what the plan was for me to be in pain? That doesn't sound like a great plan at all. And so how can we first give some of that support and validation, and continue to give that support and validation so that the distress is lowered and somebody can get to growth. Yeah, we don't need to immediately go to that place. We can start by acknowledging the pain somebody's in.
In the context of chronic pain, because chronic pain can be, like other conditions, can be a long-term and sometimes a lifelong condition.
Right.
We definitely have ways to completely reverse pain with some conditions. And
Sure.
for other people, we don't. We're not quite there yet. How do we start to look at chronic pain as there are ways that, so this is a treatable condition. It may not be curable, but it's treatable. But at the same time, it may be with you for a long time. And even within that,
Right.
there's still growth happening.
Sure.
Because a lot of different, even what I just said, there's so many different moving parts in that one sentence.
Yeah. So honestly, I think that's a lot of the next stages in the work that I'm hoping to do. So one of the things that I'm exploring now is this idea of post-traumatic growth. Well, the post isn't always there. And so what we've seen, though, is that growth is possible for individuals who are maybe actively in kind of interpersonal violence relationships and are still actively in those relationships, and growth is still occurring. Mm-hmm. Or we've certainly seen this with individuals who are in areas of war or conflict. The conflict is ongoing. There's no post anything. It's still an ongoing trauma, and the growth is still already happening. And so what we can take from those examples is that even if the pain is going to be continuous, and this may be something that we're navigating, living with for life, how can we continue to navigate that and have ongoing growth?
So present pain can still equate to positive growth.
Right. Even if we're actively in a place where there's pain or even trauma from trying to, navigate this new situation.
Which is a completely different paradigm than probably most of what is taught in healthcare.
And honestly, what's wild, it's pretty different than what's taught in mental health care. And so, it's pretty typical for us that when we talk about trauma in counseling, that we go straight to talking about post-traumatic stress disorder and maybe some of those symptoms of distress that individuals experience. And so, my field is counseling, which is really focused on wellness. The entire paradigm is, how do we talk about wellness? And so this shift is really incorporating that. So we can look at trauma and we can look at pain and acknowledge the wellness or the growth that comes out of that.
And how does that start to, because I know you've done some research in this area with regard to locus of control, which is a term that we use in pain a lot. And helping people access that locus of control. But I think what you're saying is, you mentioned, counseling models and frameworks really are based on wellness models,
right?
Bringing that into the treatment or recovery process of someone.
Mm-hmm. Absolutely. So, and when I will interview people or meet with individuals who are living with chronic illness for data collection, they're always pretty grateful that somebody's talking from this lens, as opposed to tell me all the things that have been really difficult as a result of your chronic illness, right? And so personally, I would love to come from, and some of the recommendations I do through my research are coming through treatment in a strengths-based approach. And so, you speak about locus of control, and some of these approaches naturally will allow individuals to take some of that power back, which, how empowering is that when we know that with chronic illness, sometimes so much power is taken away without our consent, right?
And trauma itself is a power struggle.
Absolutely, absolutely. And so to have a really strengths-based approach for clinicians, and one of the things I write about is a narrative theory approach. And so narrative therapy is an approach that can really work with clients to empower them and take back some of that power that has been taken as a result of trauma or changes in your body that you didn't ask for.
So as a mental health professional, you've done some research in this area, and you mentioned that they're not always trauma sensitive approaches that are going on. How would you like to see that change so we can start to incorporate more of this post-traumatic growth or positive growth into treatment, I think, and recovery?
Yeah, I think the first part, you hit the nail right on the head when you said this isn't exactly how we typically are trained in healthcare. And same again for within mental health care. And so I think part of it is just acknowledging that there is this other side to the coin, and trauma can also bring this growth with it, and that those things exist simultaneously. And so we're not saying to take away any of the treatment approaches that we've been using for pain and trauma, but to also add in this piece of this other experience that clients might be going through. And so I think bringing that to the forefront would be really helpful. I think also because we know that support and meaning are just huge aspects of this, to bring those into treatment and see how can we support clients? Are there support groups that we can be opening up? And knowing that meaning making is so important, are they support groups that can be run with a counselor? And so, getting together for pizza and sharing experiences is great. And I don't want to take away those, but also can we have some support groups or process groups that are also sharing kind of meaningful stories where people can share about what they're going through in ways that will help them to make sense of this experience.
Trauma is oftentimes a part of life. People experience
Sure.
many different types of trauma. Some of them are even medical traumas, which are key to the chronic pain community, I think, because they encounter a medical system that really isn't prepared to treat them physically or emotionally.
Right.
Do we have a sense that people can actually go through these phases and stages of post-traumatic growth even without the help of a licensed professional?
Absolutely. So the keys there are going to be, are there other people in their life that are able to have these conversations with them? And the tricky thing is that in cases of trauma, those are some of the things that we see go, right? And so we may have these really meaningful connections in our life. Family would be great, significant others, really close friendships would be great.
Peer groups.
Right, absolutely. But if we're, in pain and it's making us maybe isolate ourselves, or we're not able to go out with our friends anymore, or we're feeling depressed. And so these are things that can really sabotage relationships. And so it's a really difficult situation when the key to experience this without, the potential intervention of a licensed professional would be to have really strong support in place. And this type of trauma is something that can really mess with some of your supports you have in place. And so, trying to maintain those supports despite or in spite of the pain can be really, really helpful.
I know you mentioned you're actively researching in this area, which I think is exciting because it's definitely needed.
Yeah.
Can you give us a sneak peek into some of the things that interest you that may be on your horizon?
Yeah, so something that's coming out soon will be this idea of spiritual bypass. And that is this a term you're familiar with?
So I know, I'm familiar with it, but please let us know more about it so
Sure.
everyone understands.
Absolutely. Yeah. So it's, I spoke about the influence that spirituality can have in healing or getting to a place of growth following trauma. But I have an example from a client that I can share. So again, a client living with HIV who said that they just weren't going to take their medication because it was a hands up, God will take it from here type situation. Just a very strong faith to the point of asking God or a spiritual being to bypass, right? And to just kind of take over from here. And so what we're finding is actually, in the literature, it will say that this can be a really problematic clinical approach. In counseling, we like to say, you can't go around it, you got to go through it. And so spiritual bypass is going right around it. We're not going to deal with this head on. We're just going to pretend this isn't happening a little bit. And so it really takes the going through it out of the picture, which is not typically what we would recommend. But what we're finding in this data set I have right now that we're hoping to send out to publication soon, looking at individuals with chronic illness, is that that spiritual bypass can help get to a place of growth, because what it does is, for better or for worse, temporarily takes a bit of that pain away. And so, would I say that this is an ideal long-term clinical solution? Probably not. But I think there's some research coming out of spiritual bypass in general, and hopefully with this data that we're presenting with spiritual bypass and individuals with chronic illness, that suggests that there might be something more here. And it, even if it's not the long-term solution, it can eliminate pain for a little bit in a way that can help people get to a place of growth.
So it's almost, so instead of a bypass, it's almost like a spiritual shortcut to the post-traumatic growth.
Yeah, because it's eliminating pain. I mean, what a stress relief if it's like, I don't have to deal with this. My higher power is going to take over from here. So I can sit this one out for a minute. Yeah. And so it does eliminate distress quite quickly to get people to growth. Yeah.
It's really interesting because a long time ago, way back in this podcast series, I did an episode on spirituality and pain. And we talked a lot about how when you look at the research on treatments for chronic pain, most of them have minimal outcomes. Exercise, minimal.
Yeah.
CBT, ACT, pretty minimal. Mindfulness, minimal. All minimal. When you get to spirituality, you start to see more like moderate outcomes.
Yeah, it's wild.
Just with one intervention. And then as you mentioned, it's wild. It's like, okay, what is it about that? Like, obviously, it's, I'll say this lightly. If we think that God could come down and take our pain, or whatever spiritual entity you connect with, okay, that we can't really prove that. But what is happening there in that relationship between you and that belief that is helping you cope with whatever it is that the challenge is?
Right. And something, I'm imagining this is something you see in your field as well, but certainly in mental health, we see that people are really nervous to talk about spirituality with clients. I mean, this is right. We don't talk about these things on first dates. So we're not used to talking about them ever. So we don't talk about them with clients. But if it's a part of somebody's identity and a strong piece of their identity, how they move through the world, how they cope, then we're really doing a disservice to our clients or our patients by not talking about their spirituality. And so something that we try to advocate for our students, our counseling students, is this is a part of somebody's cultural identity. So in order to be culturally competent, you need to be really exploring their spirituality and seeing if that's an important part of their life.
Yeah, the other side of that is of course, one of punishment. Right. Which is a whole nother topic in and of itself, a whole nother episode. But you start to see, okay, how does that, because spirituality, as you mentioned, is part of that post-traumatic growth. Right. What is it about spirituality that can either help or potentially hinder someone's PTG?
Right, because you talk about punishment. So there's some data that we have with, seeing a higher power as benevolent and kind and forgiving. Or if you think about it in terms of chronic illness, like the higher power is the reason that I'm suffering in this way. This is my punishment, right? And so we do see different relationships with post-traumatic growth based on the way that you view God or a higher power. And so, if we know that somebody is turning to a higher power in a negative way or is using it as a really harmful coping, then how can we work with that to kind of work with that relationship and acknowledge that relationship so that it can go into a place that allows growth?
Yeah. I mean, in the world of physical therapy, spirituality is still, I think, a really untouched area that most professionals aren't talking about. And as you mentioned, you're probably even just starting to touch on it is useful to probably someone's post-traumatic growth in some way.
Absolutely.
And there's always obviously referring people out to resources that may help them with those types of topics if you don't feel well-versed or
100%. Yeah. We don't need to carry the burden of, knowing the ins and outs of everybody's spiritual relationships and all those things. But if we find out that this is something that's important to somebody, and maybe it's something that's also causing distress, maybe they're having anger with God because of their illness or their pain, can we refer them, to a leader in their religious community who might be able to navigate that relationship with them?
Yeah. Well, most of your research is interesting to all of us here on the Healing Pain podcast. So we definitely want to be able to follow you and follow the work. I'm sure people will start to go into Google Scholar and PubMed and start to look up some of your research. But tell us how we can follow the great work you're doing.
That's the best way to find me, actually, to just put that complicated last name with a Z. That's really scary because it starts with a Z in there, and find some publications on this. I currently teach at the University of Central Florida. So if you are looking at my name there, then you'll be able to find my vita and see those publications that might be of interest. Excellent.
So of course, all of you know how to use PubMed and Google Scholar, and I'll link to the show notes at the University of Central Florida so you can find Melissa. I want to thank Melissa for giving this great introduction on post-traumatic growth and chronic pain and chronic disease. Make sure you share this episode with your friends and family on Facebook, LinkedIn, Twitter, Instagram, or where anyone is talking about post-traumatic growth. I'm Dr. Joe Tatta. We'll see you next week. Take care.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.